Before we start the podcast, we wanted to let you know about WestOS. If you're a teacher or pupil at a school in Scotland, then you now have access to hundreds of quality assured video lessons created by teachers to support your remote learning. You should be able to find WestOS within the app library of Glow, where you can add the tile to your own personal launchpad. Click on the tile and you'll have immediate access to stream lessons in every area of the Scottish curriculum, with video lessons already available for biology at National 5, Higher and Advanced Higher. Now let's get on with the podcast. This podcast is sponsored by Leitch textbooks, revision guides and practice papers. Everything you need to learn, review and prepare for your senior phase assessments. Browse the books at www.leckiescotland.co.uk and get 40% off using the discount code LECKIEPODCAST40. You can now also collect Young Scot reward points by using the codes within the description of each episode to claim discounts and rewards on their website www.young.scot.
The next phase of reopening education will take place on March the 15th, and I can confirm today that from that date, 15th March, unless new evidence or new circumstances force us to reconsider, which we of course hope will not be the case, all children in primary 4 to 7 will go back to school on a full-time basis. All primary school children will also be able to return to regulated childcare, including after-school and breakfast clubs. We'll also take the next steps in a phased return to secondary school from 15th March with a clear expectation that all school pupils, all secondary school pupils will be back in school on a full-time basis following the Easter holidays.
That was the First Minister speaking in Parliament last week, announcing the next phase in reopening schools for all learners in Scotland, which begins on Monday. If I'm honest, I think I'd hoped that we might not have required a further update on coronavirus in schools when we last spoke with the National Clinical Director. But as we emerge from another national lockdown, it seems a good time to welcome back someone who's become a good friend of the podcast, Professor Jason Leitch.
Thanks very much, Paul. It's good to be back. And I think I always knew we were coming back in some form. I'm sorry about lockdown number 2, but I think at some level we were not going to be out of this for a while, and we're not out it yet. Early signs, bit of light at the end of the tunnel, particularly for schools and learners and teachers, but let's think about that.
They do say that third time is a charm, so how hopeful are you that this might be the last time you're on the podcast providing an update on schools, and is the end of the pandemic really in sight?
That'll depend on you for the podcast invite. As far as the virus is concerned, the pandemic isn't finished. The pandemic continues. Just to put that in perspective for you, 1 million people in Europe got a positive test in the last 7 days. 1 million people across the whole of Europe. Now, Scotland's pandemic is slowing down. It's slowing down slowly, but it's slowing down. So we're going in the right direction, but the world is not. The world is still accelerating, particularly in the Americas and across bits of Europe, particularly Central and Eastern Europe and other parts of the world. So it's good news for us, but it's not such great news for the rest of the world.
Obviously, for us here in Scotland, the schools are returning on Monday, which we're obviously all starting to still get excited about. What advice do you have then to secondary pupils as they're heading back into schools? Some of them might obviously still be feeling a wee bit nervous about the virus, especially given what you've just said.
Yeah, so let's remember, schools were never shut. So quite a lot of the folk who listen to this were still there. My wife was teaching sometimes at a dining table, but sometimes in the school. And then last Monday, a couple of Mondays ago, we put back P1 to P3 and some of the, let's call them the critical path senior kids, young people from S4 to S6. So quite a lot of them have been back, and they've been the vanguard for our testing and for the mitigations, the safety measures that are in place. But now, as next week comes, because the numbers have stayed relatively good, although not coming down as fast as we would like, relatively good, the rest of primary back and some more of secondary. Now, I'm sorry that's not the whole of secondary. I'd love full classes and everybody to be back to normal, but we just can't take that risk yet. But we're hopeful for that after the Easter break. So the same things apply. This new variant of the virus behaves in the same way in terms of the safety measures. So it's about hand washing and cleanliness, distancing from adults, or if you're older pupils, all of those things that we've got to know and love. And it's time together and the amount of time you have together. So that's why schools can go back, but some other things out of school can't go back, because we need to cut the average time you're with other people down as far as we can. And that's why people don't quite understand, why can I go to school and not have my pals in my house? Well, the reason you can't do that is we've got to take the average time you spend with other people down as much as possible.
Since the last time we spoke, the vaccination scheme's begun. Obviously a huge amount of science and an international effort sits behind that. What can you tell us about that vaccination programme in Scotland and the impact it's having on bringing those numbers down?
So it's fantastic. I think people will study it for years. We've now vaccinated 40% of our population. The vaccine is a global effort led by higher education institutions, universities, and private sector organisations and governments, done very quickly, but keeping the safety at the forefront of that. In the first vaccine invented by a Turkish guy inside a Belgian company inside another European country. I mean, it's literally a global effort to get to this point. And it's fantastic. It's working really well. We now know for sure that it reduces hospitalizations and it reduces deaths from the disease. So we know that the serious end of the disease is prevented. What we would love is if the minor side of the disease was also prevented. We don't know that yet because we need more numbers, we need more time. And we also want to know what it does for transmission. So even if it stops you going to hospital, can you still get it and pass it on to other people? That question, I'm afraid, is still not fully answered. The early signs are that it does stop transmission, and that would make scientific sense because if you're not so sick, you're not coughing and spluttering as much, you've not got as much virus, so therefore you don't spread the virus to other people quite so easily. But it's not foolproof, so we've still got to be careful. But 40% of the adult population vaccinated in what is about 3 months, a bit less, is an astonishing achievement, both for the health service who have done it and for the people who have come forward to volunteer.
It's certainly obviously something that should hopefully get young people excited about going into science in the future, we would hope.
Yeah, it's a fantastic little case study in how these things work. So 200 years ago, a guy realized that if you injected a tiny, tiny piece of an infectious agent, even a bit that wouldn't give you the disease, you could trick the body into making the antibodies to kill off the real virus when it arrived. And that's still the technology we use today. We've honed it and made it slicker and made it a bit quicker, but fundamentally that's what we do. If you've seen the images of the coronavirus on the TV with the ball, it looks like a football with spikes coming out it. We take one of those spikes, we take the DNA from one of those spikes. It can't give you the disease because it's not the virus, it's just one of the wee spikes. We ramp that up into a vaccine, we give you that, your body gets tricked into making antibodies to kill the virus, and they just wait. You can imagine them behind a rock somewhere, just waiting for the virus to arrive. And then when the virus arrives, they come out, they kill it, and you don't get the disease.
And the speed at which they've developed it, it's astounding. And that wouldn't have been possible 10 years ago, would it?
It would not. And it wouldn't have been possible either without global cooperation. So one of the things the drug companies do is they lose a lot of money in stuff that doesn't work. So if you're Pfizer or AstraZeneca, you have to gamble on stuff to work. So for every 10 that succeed, you might get 100 that fail. So that's quite an expensive business for a drug company to do that. So what we did as a global community was the governments kind of underwrote the finances. So they said, no, go into manufacturing, make it. Even if you fail the trials, we will still pay for it. Now, that's a huge risk, of course, for governments, but it meant the drug companies could do the manufacturing almost at the same time as they were doing the trials. So the trials came to a conclusion, they read out, and it turns out they're successful. Not all the vaccines in the world have been successful, not by any means, but these ones have worked. So the manufacturing is then ready, and you can get a crate delivered pretty quickly, and you can get it into arms as quick as you can.
Coming back to what you said about the global pandemic and obviously the number of cases still in Europe over the last 7 days, we had Steve Hubbard on the podcast in the last episode talking about evolution, and he finished up by talking about sustainability and obviously the idea that obviously as resources become scarcer, ultimately that can unfortunately lead to conflict, and in the world we live in, that's a dangerous thing. How important is it then that there is, although there was a global approach to developing the vaccine, we now also have a joined up and global approach to distributing that virus and ensuring that we're vaccinating the global population?
It's absolutely huge. And the WHO are running that for us. They're running a global vaccination program. And we are the second biggest donor to that program after the US. Joe Biden has just given them $2.5 billion to that COVAX program, which is the attempt to vaccinate 20% of the world's countries that can't afford their own vaccine, like Ghana and Malawi and other countries in the Far East and in Africa. And we've given last time I looked at the chart, we'd given 750 million across the UK. We were the second biggest donor to that. They've now started to deliver vaccine. It's a bit slower than ours, so it's going to take a little bit of time, because remember, it's not just about vaccine vials. It's about people and syringes and transport and getting it to the people who live in the villages. And so it's a big logistical exercise, but it's happening, and the world is coming together to make it happen. Now, there's huge amounts of ethics in there about where you should start and who should get the vaccine and what you should do, because the UK has bought more vaccine than it needs. So what should we do with our excess vaccine? Should we give that away when we know that we won't need it, et cetera, et cetera? So the world is catching up with that. And it's a huge point that we're not going to be safe until we're all safe.
There's obviously also there's a huge amount of talk in the media about the vaccine, and understandably so. And there's obviously debate within that conversation about whether teachers should be vaccinated. Now, JCVI guidance is obviously used to determine the priority of vaccines to ensure it makes the biggest impact. What would you say to any teacher that might be listening, and we know there are a few that do, who they might be feeling anxious, waiting on that infamous blue envelope dropping through their door? And could you just maybe outline for young people what that JCVI guidance is and why it's so important?
Yeah, so I'm married to one of those teachers, remember, so she's looking for hers, although she's over 50 now, and she'll be in one of those priority groups along with me in the not too distant future. Fundamentally, what we did, and we've done it for 30 years, is we've got a committee of boffins. And we ask that boffin committee questions. And this particular boffin committee is the experts across the whole of the UK who know the most about vaccination. And who better placed to make that decision than those people? So that's what we do. They tell us what to do with the measles vaccine, with the cervical cancer vaccine, with the COVID vaccine. So they look at all of the evidence that's available. Now, remember, there's not as much evidence available for COVID as we would like, because it's a brand new disease and there's never been a vaccine. So they've only got so much news and they can't make stuff up. So they look at all they've got and they come out with the rules, and they call the rules the Green Book. And everybody in healthcare knows about the Green Book, because that's where you go to find out what's happened about measles vaccines or typhoid vaccines. And now there's a new chapter in the Green Book called the COVID chapter. And all of us know to go to the COVID chapter in the Green Book. So what they discovered, in short, is the biggest risk factor by a country mile is how old you are. It doesn't really matter what you do for a living. It doesn't really matter much about anything else except your age. So that's what they told us to do. They said, start with the over 80s and work your way down. Stop at the over 50s, because by then we'll have a little bit more news and we'll have a little bit more research and we'll have another look. And that's what they did a couple of weeks ago. They looked again at all the literature and said, right, should we prioritize big people, small people, white people, Bangladeshi people, old people? What should we do? Should we prioritize asthmatics? Should we prioritize teachers? They looked at all of that and they said, nope, still age. And that's what they told us to do. So they told us to stick with the age distribution. Firstly, for risk, death, and disease. And secondly, for simplicity of delivery. So we know who you are and we know where you live and we know your age. And that's an easy thing for us to find, because everybody's got a health service number who's registered with a GP. And that's what we're doing. Now, the blunter version of that and shorter version is if you're a 24-year-old teacher and you've got no underlying health conditions and you want vaccinated, who would you like to take that vaccine from? Who would you like not to get vaccinated so that we can vaccinate you? And that's a pretty tricky question because we don't have 9 million doses of vaccine, which is what we need to vaccinate everybody twice. We've only got X number. So we have to prioritize and we have to do it in order of risk.
Which seems to make sense to me. And obviously then teachers, obviously of different ages, will get that vaccine as it comes through. What about young people? Because they'll be going back into schools too. Could they expect to be getting vaccinated? And if so, when might they expect that to happen?
Only one group of young people are going to be vaccinated in the present plan, and that's over 16s with underlying health conditions. So they are in what we call group 6, and they should, in the main, already be done. They're going to be finished by mid-April, but that group in particular has gone quite quickly. So everybody over 16 with a specific set of health conditions that put you at risk of COVID, it's quite a small list, that put you at risk of COVID, they'll be done. Other young people, not yet. So they will have to wait until we do more trials. We're pretty confident this vaccine is safe in young people and children, but we just need to do the trials to be absolutely certain. And clinical trials always start with the healthy, then they move through the age groups, then they move through the diseases, just to make sure each group is fully tested. Pregnant women who are trying to be pregnant, kids, young people, etc. So just now, those trials are ongoing. So there are young people across the UK being vaccinated as part of the clinical trials. And hopefully we'll know that in the second half of the year. And as we do booster doses, I would expect young people to be included in that second round of vaccination. I can't know for sure, but that's my gut feeling.
And I guess those booster vaccinations will almost work similarly to maybe getting the annual flu vaccine, would they?
Yep. And some of the drug companies are even working on a joint flu COVID vaccine. So it wouldn't surprise me at some point if we've got a nasal spray or we've got a patch or so just now you get a vial, it's got 10 doses in it. You've got to use it in a big centre because it's got to be kept in a freezer. And so it's all very complicated just now because we needed quick vaccine as quick as they could do it. Eventually, we'll get much more user-friendly. It'll be delivered in a much more global way across the whole nation. We'll do it all together, probably every winter. We don't know any of that for sure, but that's likely how it'll end up.
None of those 2-in-1 vaccines, of course, won't contain any microchips either. There's been a huge amount of fake news around vaccination programs. How challenging has that been in terms of the vaccination rollout?
A little. Most of the real edgy stuff we can ignore. So nobody in the mainstream really believes there's a microchip in the vaccine. No. So the tactics for dealing with that is to ignore it. Most of the psychology and the behavioral scientists tell us don't tackle that right face on. Just ignore it because sensible people know it's garbage. The much more difficult bit is vaccine hesitancy, where people are absolutely genuine about, and they ask questions like you've just asked about how was it done so quickly? Can we give it to children? Can we give it? I'm trying for a family. Can I have it? I've got a kid who lives with autism. Can I give it to them? Etc. Etc. So those questions are completely authentic and genuine. And the way to get them is just to keep giving that good information, that trusted voice out as much as you possibly can. Whatever that community might be, that might be an ethnic community, it might be a religious community, it might be gypsy travellers, it might be young people. So Young Scot have done a lot of work with us about how to spread that message. We've also had to do it in care homes for older people. So you have to adjust the voice and adjust the message depending on what you're trying to get across. But the behavioural people tell us just surround people with the right information rather than tackle the wrong information.
And you, of course, you've been one of the big voices, certainly across Scotland, in delivering that message. And it's very easy for most of us, I think, to forget that as National Clinical Director, your official remit's, of course, much wider than just COVID and takes in far wider aspects of the nation's wellbeing, as you explained to us the first time you came on the podcast. As we all start to look forward to kind of going back to school next week, how important is it, do you think, that we use this as a moment to really consider our general well-being and look out for our friends and families and ourselves.
I think there's two subjects in there you've touched on. I think it would be great if we took the opportunity. Pandemics are not good, they're evil. Pandemics are horrid, and over 9,000 people have lost their lives in Scotland to this pandemic, and we should reflect on that as we reach the anniversary of those deaths and the first lockdown, etc. However, can you build better out of it? I think maybe you can. It exposes the inequalities in our country. It exposes some other public health challenges in our country. And if we could tackle obesity, exercise, some of the poverty, etc., as a result of the pandemic, I think that'd be a great thing to do. And young people have already shown us that they can do kindness, they can do compassion, they can go around the older people in their community and check they're okay and look after them. And I think we should try and continue as much of that as we possibly can.
You've been very busy and under pressure throughout the pandemic in a professional sense. How have you managed to look after your own well-being through that time?
Well, the first thing to say is, and it sounds a bit patronising, doesn't it? It sounds as though I'm dodging the question. But the first thing to say is there's a lot of people working a lot harder than me. A shift in a care home or a shift on a supermarket floor is harder than my job. I've got central heating. I've got a job that pays me. I've got no risk. If I get self-isolated, I'll be paid. I'm well looked after. I've got a lovely supportive family and I've got meals on the table. So there's a lot of people having the pandemic tougher than I have. However, the job is not without challenge. It's pretty intense. It's not a lot of days off, not a lot of time off. So I've tried to keep that balanced by spending time with family, some of that digitally, of course. And I eat 3 meals a day, I sleep for 8 hours, and I run 5K. I'm not sure if I used that formula for you the last time. Now, that's not good for everybody. Not everybody wants to do that, but that's my formula to keep going. So 3 decent meals a day, 5K, and I sleep for 8 hours.
Yeah, I know this is a podcast and people can't see me, but obviously you can. And that idea of running 5K is certainly something that recently I've kind of tapped into to try and improve my own, the way I'm feeling.
I love it. And I'll give you a little...
It's getting easier. It's getting easier.
It does get easier. The other thing I've done is, the other secret to the running is audiobooks. So I have listened to 170 hours of Game of Thrones during the pandemic. So I'm nearly finished book 4. I haven't watched the TV show, haven't read the books, didn't really even fancy the books, but I had the first book on my iPhone and I've now listened to 170 hours of Game of Thrones. I'm nearly finished the 4th book and it's fantastic. Takes your mind off everything.
Great television as well. 8 hours a night's sleep sounds remarkable. What is Jason Leitch's bedtime routine?
It's reading. So usually after the news. So if I can bear another round of pandemic news, if I'm not on it, then I might have to watch it. And then Lynn and I try and relax a little bit. So we might watch, right now we're watching Bloodlands with, some people might have watched that with James Nesbitt in it. I've absolutely no idea what's happening. But so you might relax with a bit of television, chatting to the family, and then bed relatively early. Actually, I'm not a big midnight 1 a.m. guy. Read a book, fall asleep, get up again at 7:30, 7 o'clock, something like that.
That comes back to the idea of running 5K. Is that something you do daily then?
I try and do it most days. I ran 6.5 today, so I had a little bit of a break this morning, and I did some media first thing, and then ran. I live quite near a park, so 3 loops of the park is 6 and a bit K. So I did that. We really shouldn't call it running. It's not moving very fast. I'm a middle-aged overweight guy, so I'm not. It's not Mo Farah. Let's be clear. But at least I'm moving, and my heart rate is up, so it feels good, and I always feel better after it.
I think I would put myself in that category as well. It just strikes me though that obviously that's something we can all do though, regardless of circumstances, regardless of finances. We can all get out and we can all move on the streets and we can all go out and do that, and that's something we've become a wee bit more reliant on. You don't need a gym membership to be able to do that, and that just strikes me as something that we can all access just to kind of keep up our general well-being and health. The last time we did speak, you were hopeful the Tartan Army would be in Hampden in the summer. How hopeful are you now? And what might the summer holidays generally look like for everyone? I know we're not back at school quite yet, and we're only going back on Monday, but what might the summer holidays look like?
Yeah, it's a little bit crystal ball gazing, but let's have a go. I'm still hopeful that there'll be a crowd at Hampden. I don't think it'll be capacity. I think there'll still be some element of safety measures. Remember, it's also not just the stadium we need to think about. It's the transportation. It's everything that goes on around big events. So it's not just the outdoor moment at Murrayfield or Hampden or Celtic Park or Ibrox. It's getting everybody there and getting everybody out of there that also gives us a bit of a challenge. So we need to think in the round. I'm hopeful that we'll have some people there. I'm hopeful that all 12 countries will be able to do something. We're in negotiation just now with UEFA and the SFA about what that might look like. And so is Bilbao in Spain and Azerbaijan and England and Scotland. So we're trying to do it as a continent, and we want it to happen. I mean, it's a fantastic opportunity for Scotland to play in this championship and to do it at home. I want to be there along with hosts of other people, but we've got to do it safely. The last thing we want is it to cause COVID outbreaks and harm. And that's the same fundamental lesson about what the summer will look like generally. I think by the summer, if vaccination continues in the route it's headed, we'll have vaccinated the adult population, most of it. We'll be able to do much more travel inside Scotland and inside the UK. I am not sure what international travel will look like, because remember, international travel has two ends. It has the place you're going as well as the place you're coming from. So it depends what's happening there as well as here. So we may go back to a world where there are travel corridors, where there are safe bits where you can go back and forward from, and other bits you can't. But it's too early to predict what that will look like. But with a fair wind, I'm very hopeful that we'll have summer time off. We'll be able to travel in Scotland and in the UK. I'm just not sure if we'll be able to go to the coast of Spain.
I can't help but think that brings us right back full circle to where we started, and that the pandemic is still ongoing, and we are getting excited to go back to school on Monday and hopefully getting back full time after Easter holidays. But I guess, throughout that period of getting back to school and then into the summer holidays, there will be a responsibility on all of us to continue to play our part as individuals.
Yeah, vaccination will help us, but it's not the single answer. The vaccination is a means to an end, not an end in itself. So vaccination will help drive down incidence and hospitalizations and mortality. And the other way we drive down incidence is by our individual behavior. That hasn't changed. So if we wash our hands, if we only leave the house when we have to, when we're going to school or going to educate or whatever, then we help just that little bit more and get incidence down. We had over 600 cases today. We had 400 cases yesterday. So this virus hasn't gone away. There's still people being admitted to hospital and intensive care. So we shouldn't be scared of it. And we should go back to what we're allowed to do, but we should do that carefully. And we should do it with one eye on keeping that incidence down. And I'm very hopeful over the next few months that will continue to be the direction we go in.
And hopefully, if it is the direction we continue to go on, it'll be a wee while before you're back in the podcast.
Well, that'll be up to you, Paul. But I certainly hope so. I look forward to the post-pandemic celebratory podcast, perhaps.
Before we begin to think about what a post-pandemic celebratory podcast might involve, I want to finish by sending our best wishes to everyone getting ready to go back to school on Monday. Many of you will also be starting to think about assessments or have other worries. As Jason said, the pandemic and lockdowns are not fun, and everyone will be facing their own challenges. So be kind to yourself and to each other. Don't worry about what you might need to catch up on, but be positive about what you've already achieved and make the most of being back in school. Take some time and check the I Feel content on the Young Scot website for further advice on looking after your own well-being and what to do if you need a little bit of support with your own mental health. Our next episode will be covering the Gene Expression unit of the higher course with Professor Owens from Oxford University, and there'll be more episodes covering more of the higher course coming soon. You'll also find a range of video lessons to support your revision across a range of subjects on West OS, which all learners and teachers across Scotland now have access to via Glow. As always, make sure you subscribe to the podcast on your preferred platform And remember, you can get 40% off all Lecky textbooks, revision guides and practice papers using the discount code LeckyPodcast40 online at www.leckyscotland.co.uk.